This is Crystal. I'm the physical therapist at Family Chiropractic and Wellness, and today we're going to give you a glimpse at what a craniosacral therapy session would be like for someone who comes in with a headache. We start with an evaluation, a quick evaluation from the feet all the way up to the head, and then we'll do the treatment, and then at the end we'll do the evaluation in reverse to compare our findings from what we had at the beginning. So the first area that we look at is the heels, and it's very, very light pressure, and I'm feeling for just a subtle rotation and trying to feel how symmetrical the movement is, how big the movement is, how smooth it is. The next area is the top of the feet. And then the thighs. And the hips. And then at the ribs, so I'm just going to have you put your hands at your sides here. Again, it's a subtle movement, and I'm just looking to see how much and how equal the movement is on both sides. All right, and then you can put your hands however it's comfortable. Next, we're going to look at the shoulders and upper back. And then I'm going to push a little bit harder for the evaluation piece just to see how well things move, if there's any more tension on one side than the other. And then the last area is up at the head. And here I'm feeling, again, for movement in several directions for this one. But there should be nothing uncomfortable about the evaluation or the treatment. And then based on my findings, I decide where we need to start with treatment, whether it's in the ribs or with headaches, probably more likely more at the shoulders and up in the head. So the treatment here would be very much like this. And then there's a few different hand placements up at the head. This is one of the more typical ones. And each area could be treated for 2 minutes or 15 or 20 minutes, depending on what your body needs on that day. And so we stay there as long as we need to, and then we move on to the next area when your body's ready. And at the end of the treatment session, I would go back through and reassess the symmetry of movement in each of the areas that we did at the beginning. And that is a glimpse into what a craniosacral therapy session and evaluation would look like here. Thank you.